Today, we are excited to welcome Dr. Amber Gibbs. As Superintendent and CEO of the Cuyahoga County Board of Developmental Disabilities, Amber and her team support more than 15,000 Cuyahoga County residents with developmental disabilities and their families each year to live, learn, work, and play in the community. Amber's career of service dates back to her high school years when she first began working with people with disabilities. After several years in both the mental health and DD fields, she joined Cuyahoga DD in 2008. After serving in a variety of leadership roles, she was selected as superintendent and CEO in 2023. A leader at the state level with the Ohio Department of Developmental Disabilities and other county boards, Amber was recognized in 2018 with the Ohio Association of County Boards Partner in Excellence Award for her groundbreaking work to eliminate the statewide Medicaid waiting list. And she serves on several statewide working groups focused on improving waiver services and fiscal sustainability. She serves on the board of directors of Community Fund Ohio, and she is an active community volunteer and has served on various nonprofit boards and as a certified foster parent. Amber is active in the Beaumont Parents Club and is a member of the Wittenberg University Alumni Board, and we are proud to have her as a member of the Leadership Cleveland class of 2026 and a graduate of our Civic Leadership Institute 2022. Please welcome Amber.
Thank you so much, Rachel. It's so good to see everyone. I do have some slides that I'm going to share with you to talk about the organization that I'm so excited to talk about today. So let me see if I can do this. All right, we seeing the right stuff, Rachel?
Looks good.
Perfect. Okay. So I'm going to start off with our mission at Cuyahoga DD. I love this mission. It is to support and empower people with developmental disabilities to live, learn, work, and play in the community. And what's so important about this mission to me is we were very thoughtful with the words. We do not do this for people with disabilities. They really are at the center of all that we do. They choose what they want out of their life. They are the directors. They are the ones that tell us how we can empower them. And you can see those themes of self-determination and inclusion here in our organization values. We also really focus on innovation, how to do things new and different ways, making sure that people have a positive experience, that our staff are experts and professionals in their field, and most importantly, that we really focus on the health and well-being of the people that we support. Some fast facts about our organization. We were established in 1967, and I think this is one of the coolest things about our organization. We were established by families who had children with developmental disabilities. At that time, those children were not allowed to participate in school, in public schools. Families were told that they should put their child in an institution, and that was the best thing for them. And families said, no, this isn't good enough for us. And so they went to state lawmakers and said, this needs to be better. And the result was a law that established a county board of developmental disabilities in all 88 Ohio counties. We are one of the only states that functions in this way, and I think it's what makes our services so incredible. We serve over 15,000 people every year of all income levels, and our primary funding is through a levy that we passed in 2005. We told voters at the time that we would make that money last for 10 years, and here we are 21 years later with the same funding source. Our board is made up of 7 members. 2 of them have a developmental disability. They are incredible advocates, and they bring their own lived experience to my governing board, which is incredible. And the other 5 members have a family member with a developmental disability. So they are very invested in the work that we do, and they bring challenges to us about how to be better every day. We are a leader in the state in terms of supporting people in innovative ways. We are proud of the fact that in Cuyahoga County, we are the 2nd largest county, and we really bring new ideas to the table and try new things that are adopted by other county boards throughout the state. And something that I get questions a lot about is, are we a government organization? Do we report to the county executive? And the answer is yes and no. We were established by a separate state law, so we work collaboratively with the county executive and the county council, but we do not report to either of those entities. although the county executive does appoint several of our board members. We are funded, like I said, primarily by a tax levy from 2005. That's almost 80% of our revenue. So we are heavily reliant on property taxes. And our expenditure budget this year is $177 million. The largest expenditure that we have is payment for services through the Medicaid waiver program. That is a program that allows us as a county board to pay about 40% of the cost of services, and the federal government kicks in the remaining 60% of service costs. So that is a large funding source for us. That is a primary way that we provide lifelong supports to people with developmental disabilities, is through that program. This year, we will spend $89 million on our portion of that Medicaid waiver match. And that $89 million will bring in about $500 million in economic services to Cuyahoga County. So it's a huge impact on our community. With that $500 million, there are thousands of direct care staff and other support teams employed by that money to serve people with disabilities. Some quick key messages about our organization. Like I said, we serve people throughout the lifespan. We literally get calls from families when they are in the hospital with a newborn, and we are with people until they advance into old age and pass away. Our eligibility for our services is not based on income. And we really focus on the people that we serve. So everything we do is person-centered. We provide services in natural environments. So we are in people's homes. We are at people's workplaces. If someone is having trouble navigating the community, that's where we're going to serve them. They're not coming into our buildings to get services. And all of our work really focuses on what the person wants for their life. And every single person has radically different services from every other person, because every person with a disability is unique. And one of the biggest things that we focus on, especially as our organization evolves, is serving as a resource to the community in terms of inclusion and accessibility. You know, when we were first founded, we used to actually have to operate schools, and we operated day programs because that wasn't available for people in the community. But now most people go to public schools. And so we've evolved in what we do. We like to make sure that the community knows how to be welcoming and accessible. We provide so many services. This is just some of them, and I'll take a couple minutes to talk about them. We provide assistive technology. We find that technology really helps people be more independent in the most cost-effective way. So things from very low-tech pill minder that many of us probably use to remember to take our medicines, to something very high-tech like a remote support system in their home where they can activate staff on camera with just their voice to help them remember to get up in the morning and get ready for work and check in on them if they're not feeling well. Really the range of options here. We have a behavioral and health support team that help individuals who are having challenging behaviors learn new and productive ways to communicate about what they want and need so that they can live very full, productive lives. We have a criminal justice support team, and the purpose of that team is not to help people avoid consequences. It's really to help people navigate the criminal justice system so that they understand what is happening if they are involved in the courts. Our early intervention program is very, very popular. We serve thousands of children between the ages of birth and 3 to help them meet developmental milestones. So we're teaching parents how to help their kids sit up on their own, or learn to eat, or be able to have mom go to Target and have a child navigate that, because it's a very sensory experience for a lot of kids. So it's really based on what the child needs. We help people find jobs, and we work with many different providers in a collaborative who bring us job leads, and then we match the job leads with the right person served by different providers. It's a really incredible opportunity for people to find the perfect job for them. And so we are always looking for employers who want to hire the right staff person, so we can work with you to find the right person to fill your needs. Our Family Supports program is a program for people who have a loved one with a developmental disability living with them. It gives them a small annual allowance to allow them to purchase things like camp or respite or equipment. just to offer some relief for families that are doing so much for people with disabilities. We have housing opportunities all over the county, every neighborhood you can think of, from apartments with technology in them to help people be independent, to places where people might be sharing services with 2 or 3 roommates and sharing rent and sharing utilities. And we develop a lot of housing opportunities. We work with our housing corporation provider to help us with that. And we really try to find the right fit for people to live in the neighborhood where they want to live, where it's important to them to be near their community and have the best experience. We have sign language interpretation services. Our support administration is like our case management. Those staff are doing assessments and figuring out what people need and then connecting them to those services. We have therapies like occupational, physical, and speech language therapies. And we do travel training to help people navigate the community, whether it's walking around in their neighborhood or taking the RTA or learning how to use Uber. So really meeting people at any stage of their life with whatever they need to live their best life. A couple of cool things that we're doing that I wanted to mention. We're doing so many, but I picked 3. We have a great partnership with Florio, which is a virtual reality software company. And we've actually worked with them to develop modules to help people identify safe online interactions. So recognizing when people are being tricky or deceitful, whether it's through gaming or social media or email, helping them interact with these situations in a safe virtual environment so that they can take those skills into a real world scenario. So it helps them build judgment and evaluate how to trust, when to trust. There are dozens of modules we use with Florio, including things as simple as how do I go to McDonald's and order a sandwich and interact with a cashier, to what do I do if I'm stopped by a police officer? So it's really this incredible use of technology that we're excited to do, and we help develop the modules. We have a new program that we call the Essentials of Life Skills program. We heard this from families and individuals for many years. They graduate from high school and they say, we learned some skills, but we don't know how to do laundry or plan groceries or, make meals. We need help with balancing our money and figuring out how to budget. We need skills like how do I interact at work, getting up on time, showing up in the right clothes? How do I handle it if I'm upset with my boss? Those kinds of real world skills that we have been doing. Now, this is, I think, our 3rd class. We're getting rave reviews. And we offer these in 6 months increments. And over the next year, we're going to be expanding them to evenings and weekends and sort of one-off classes. So if you don't need the whole program, but you really want to learn more about your finances and how to manage those, we can accommodate people in that way. And then the CSU Rise program is one of the feathers in our cap. We worked with Cleveland State to develop a 2 to 4 year transition certificate program for people with intellectual and developmental disabilities. They get to be on campus and take both gen ed classes and Rise specific classes to help them with things like writing a resume and learning life skills, how to navigate a campus, how to take a bus around downtown, all of those types of things. And all of the students have on-campus jobs, and some of them choose to live in the dorms. So it's a great experience for someone that might not be ready for diving right into their freshman year of college, but want that same experience that so many kids out of high school really want and need. In the community, we are investing in so many different organizations, libraries, arts and culture organizations, and recreation organizations to help them make their programming more adaptable. So we might give them a little bit of money and they adapt their yoga classes and their swim team so people with disabilities can participate. We've installed over 20 universal changing tables in Cuyahoga County so that people can use the restroom with dignity no matter where they are. And one of the ways we impact the community most is we pay the waiver match, like I said earlier, for services that are provided by hundreds of private providers in our county. So if you've heard of some of those providers like United Cerebral Palsy or Jewish Family Services or Welcome House, we're paying the match so that they can provide those services, and people get to choose from all different kinds of providers. How you can help us: you can help fulfill my personal dream, which is to make Cuyahoga County the most welcoming and inclusive place for people of all abilities. Clevelanders have that spirit already. And so it's just really about recognizing where we can modify what we're already doing to make sure that people feel included. We have internships and careers and volunteer opportunities if something sounds interesting to you or you know someone that's looking for a career change. You can share information about our mission and our services with other people so that they find us and can get what they need. And really stay informed about property tax issues and our levy funding. We are going to be coming to voters over the next year. Things cost a lot more than they did 21 years ago. We're serving more people than ever, and we're probably going to need some additional funding. And then really promoting inclusion and advocacy for people with developmental disabilities. About 30% of the population has a disability of some kind. Developmental disabilities is a smaller proportion of people, but we really, it's a huge part of our community. And so making sure that we can make Cuyahoga County accessible for all residents is something that I would love to see everyone on this call sort of take as their personal charge. That was a lot of talking in a short amount of time, but I wanted to get through so much. So that's where I am. And I would be glad to hear if there's questions, Rachel.
Amber, thank you. Uh, Love the program with CSU. Can you talk how many students typically participate in the RISE program each year?
It depends. I think the program is only 3 years old, and so I think it's anywhere between 8 and 15 students currently. It changes over time. I know we also partner with College Now. We offer an endowed scholarship to help students pay for the RISE program. The RISE program is also in the process of becoming accredited so that students will be able to access federal financial aid to attend the RISE program. There are other programs in the country like this, but we really saw a need to have one in Northeast Ohio because, like I said, I'm a big Cleveland fan and supporter, and I said, why don't we have this? And Cleveland State really rose to the challenge, and they've been doing a fantastic job.
So, building on the idea of the partnerships and collaborations, what other organizations, entities do you collaborate to provide the various services?
So we have actually a few hundred private providers that do direct service. And so I would not nearly be able to name them all, but they certainly are very involved. And then in addition to those few hundred private agency providers, there are independent providers that can become certified by the state. So it might be your neighbor that you've known your whole life that really wants to help you and provide services and be paid for that. So we do a lot with those providers. And then our focus, like I said, has been looking at other organizations that don't necessarily serve people with developmental disabilities. So city rec centers who are already offering swim programs and yoga and all of those things. We've partnered with the, Playhouse Square and the Cleveland Playhouse and the Beck Center and all of these places to say, you're already doing this incredible work. How can we help people with disabilities access those programs and services? So we're sort of everywhere. And if you're on the call and we're not working with you, but you want to, we want to hear about it because really the idea is to give people with disabilities the same choices and options that the rest of us have.
And do you as an organization step into the advocacy space, whether that's locally, state, federally, and what might that look like?
Yes, that's a great question. We do. We meet with all of our local representatives for Ohio that cover Cuyahoga County at least once a year. We just recently had our advocacy breakfast where we invited all of them. We had about 30 advocates, so people with developmental disabilities here to have coffee and breakfast and talk with them about what their lives are like. And so it's really about us connecting people with disabilities to the lawmakers. And so we advocate both on the local level here with our county executives and council members, with the state and at the federal level. We also use something called Voter Voice, where we can connect people that we serve through text messages to say, hey, this is something that might be happening that's going to impact you. Here's how you can reach out to your legislators and tell them what's important to you. So we have a great advocacy program in Cuyahoga County. We're constantly working to help people hone their advocacy skills. We have a leadership council that actually is a group of individuals with disabilities that advise us. They look at our programs, they look at our communications, they tell us where we need to be focused on doing things differently and better because they're really the experts. They're the ones that live this every day.
What are some of the most common misperceptions about the community, the developmental disabilities community, and how do you work to combat those?
Yeah, I think some of the misperceptions are that people with developmental disabilities don't have skills and abilities like the rest of us, or that they're all very similar. You know, they all need the same thing, and that couldn't be farther from the truth. I learn from people with disabilities every day. We see people with disabilities doing jobs all over the communities. You know, we have. I know of an attorney who has a developmental disability. We see people working at the arenas in town. You know, at the Browns Stadium and the Cavs Arena. We see people. We have people that work here that are in our records department and running our IT department. And so it's really about taking the time to see where each person is, just like we would do with everyone else, right? And finding what their skills and interests and abilities are and matching them with the right opportunities in the community.
Can you discuss and give some examples of how accessibility makes things better for everyone, not just people with disabilities?
Yeah, I think, I talked about universal changing tables, right? And so I showed you a picture of that. That is fabulous for people with disabilities. It's fabulous for people who are physically disabled. Maybe they're in a wheelchair. So older people. It's fabulous for a mom with a kid who's a little bit bigger and doesn't fit on this tiny little changing table. You think about things like curb cuts. We all use the curb cuts. That's the classic example, right? That was created for people with disabilities, but parents with strollers, older people need those. Things like, I don't know, I'm suddenly at the age where on Netflix, everything has the captions on the bottom. And those are things that were created for people with disabilities, but they help all of us, you know? And so all of those things really make life easier for everyone. And we've been encouraging people to think about that. You know, I just saw that City Hall finally got some new signs, and that's an accessibility issue. If you've ever gone to a City Hall, Cleveland City Hall meeting, good luck finding where they meet, right? And I've been there many, many times. So those signs, which were created to help people with disabilities, really help me and help everyone else who's visiting the space. And I'm especially excited that we're going to be able to spotlight all the things that Northeast Ohio is doing when the Special Olympics come here in 2030. It's a huge, huge, exciting event. We're going to be reaching out to all of you and saying, how can you volunteer? How can you help? But I think that the world is going to see Cleveland and Northeast Ohio in a totally different way because we are really on the cutting edge of a lot of what we're doing for people with disabilities.
The perfect tee up for the next question that had come in, which was around the Special Olympics. So, can you share some insights on how you all have been involved and what we might expect as we look ahead to that event?
Yes. So obviously, the Greater Cleveland Sports Commission is heading that up. They are at the time right now, they're sort of preparing for who they're going to need to chair which different activities and events. They're going to have a group that's looking at, athlete experience, one that's looking at visitor experience, one that's looking at accessibility and transportation. And so we're going to need, thousands of volunteers to help run the games, to help people navigate around the city and the county. We're going to be reaching out to providers that we know that we work with already and new providers to say, transportation is going to be an issue. We need to get a whole team from here to Baldwin Wallace. How can you help us with that? How can you help in any way contribute to what's happening in the games? And so there's so much discussion going on and so much planning. I'm super excited to be a part of it, and we're going to be certainly highlighting that over the next few years as we get ready.
So, we have some providers joining us today, and there's some curiosity around for providers that already provide the therapeutic and recreational services for individuals with disabilities in the community. Can you talk about how Cuyahoga DD helps individuals access those services financially?
Yeah. So there's a couple of ways that people can access those services. First way is through our family supports program. So our family supports program, like I said, it's an annual allowance that people can use. So many families use that money to access recreation. So whether it's a soccer league or whether it's a yoga class or spin class or a basketball league, swimming lessons, swim team, they can use that money with any number of providers. It doesn't have to be a special provider. It doesn't have to be just for people with disabilities. So they can use that money. Some people who are on Medicaid waivers may also be able to access They're a specific service called participant-directed goods and services to pay for those types of programs. And we also work with people to find scholarships for various activities like that if they don't have the funds, or we can help them work on their budget to figure out how they can afford some of these things that they want to do. So we also try, through our grant process, providers can also apply for grants, and then sometimes they use that to provide their own scholarships for people to be able to participate.
And can you provide some insights into the classes you offer to help potential service providers become better prepared to offer services to the DD community?
Yeah. So we in Cuyahoga County have a very robust provider support department. It's about 20 people, which is huge compared to many other counties. And their job is to help people go through the certification process. So there are statewide classes that people can take to become certified at the statewide level. We often help them with the application process. Sometimes it can be a little cumbersome and confusing because it's a statewide system. So we walk them through that process. And then we also offer ongoing training sessions. So our behavioral health department, a lot of times will do training on how to work with someone who's exhibiting physically challenging behaviors. We connect people to classes through a couple of different places about how to work with someone maybe that has special dietary issues or special feeding instructions or texture issues. We connect people to all kinds of different training so that they can become better providers. So sometimes we provide it and sometimes we contract with others to provide those trainings.
And for someone who might be new in the field, who wants to get more involved with advocacy rights, what are some effective efforts that folks can do to really help influence policy and lawmakers?
Great question. So I would say definitely following our website and our social media. Our social media team is fantastic. We've always got stuff on there when something is happening. You can sign up on our website for our contacts, and then we'll make sure that you're getting some of those voter voice texts that we send out. There are many different organizations throughout the state that also do a fantastic job with advocacy. The Ohio Self-Determination Association is a statewide organization that really works with people with disabilities on advocacy issues. There are so many. It would be hard to name them, but we actually are working on a section of our website, sort of beefing up an advocacy section on our website so that people can go there and find out how can I get involved with so many of these different organizations.
So, Amber, you've been working in this space for much of your career. What are some of the leadership lessons that you've learned along the way?
Well, that's a great question. I have learned I really like to talk, in case you didn't notice that today. I love to talk, and one of the most important things I've learned, especially from people with disabilities, is to talk less and listen more. Sometimes people take a little bit longer to express themselves than maybe I do. And so I really have to just say to myself, shut up, give it time, right? Let someone come to me when they're ready. Um, I also have learned that sometimes I throw out an idea or a potential solution, and people need time to work through that on their own. And so I need to circle back with them. Just because they're not responding right now doesn't mean they don't like it or don't agree. I need to give them time to process it. So that's something that's really important. And then I think one other thing that I've learned is that everyone has something going on in their life and you don't know what it is. And so really giving people grace is very important. And coming into this field, very young in my 20s or in high school even, I did not give people a lot of grace. I am someone that's an overachiever and expects great things from people. I have very high standards. And I really had to learn that sometimes people are doing their very best and you need to let them have time and space to deal with what's going on in their lives.
I think that is a great way to wrap up our conversation today. So, Amber, thank you so much for joining us and for all of the work that you and everyone on your team does to make our community a better place.
Thank you so much. I'm so grateful you were all here. I hope that you learned something, and I hope to see you around at various things, and especially at the Special Olympics.